Welcome to MedTalks, your go-to source for health information and medical insights. I'm your host, Juvenava, and we are bringing you the latest in healthcare. Whether you're looking to understand the basics of wellness, gain practical tips for everyday health, or learn about community resources available to help you live a healthier and happier life, MedTalks has you covered. Join us on this journey to better health, and remember, a healthier you starts with a single conversation. Stay informed, stay healthy with MedTalks, where every talk is a step towards a better you.
Grace Med Health Clinic is your home for complete compassionate care. From medical visits to vision screenings, dental care, behavioral health support, and a fully equipped pharmacy, we're here to meet all your health needs. Our dedicated team of providers and staff work together to make every visit welcoming and stress-free. Because at Grace Med, you're not just a patient, you're part of our family. Call 316-866-2000 to schedule your appointment. Grace Med Health Clinic, compassionate care for all.
Welcome, guys, to another episode of MedTalks. I am Juvenava, Director of Community Outreach and Communications, and I am here with the wonderful Miss Peggy Jones-Foxx of the Wichita Black Nurses Association. How are you, Miss Peggy?
I'm fabulous. Thank you for asking.
Well, good. Miss Peggy, you and I have worked, Grace Med and the Wichita Black Nurses Association has worked a lot in community outreach and in services. Can you talk to me about what the Wichita Black Nurses Association is?
Thank you for that question. And I have been the president of the Wichita Black Nurses since January of 2021. Okay. Came right in during COVID and hit the ground running, had lots going on. Joined the previous year in May of 2020 and became the president January of 2021. Okay. And so we are a Black Nurses Organization. We are a chapter of the national organization, which is in Silver Springs, Maryland. Okay. And we are 52 years here in Wichita.
Wow, that's incredible.
We've been here a long time.
That's incredible.
I haven't obviously been here that whole time, but I have members that we call charter members that have been here through those 52 years that we have been here. Okay. So this organization is a faith-based organization such as Grace Med is, and that's why I believe our partnership is so critical and has been so good, because we are both a faith-based organization working in the community to try to close the gap in terms of providing access to health care. Yes. So we are, in terms of our mission, we focus on advocacy, leadership, healthcare maintenance and disease prevention, and we seek to focus on, but not limit to, Black and brown people in the Wichita community.
That's incredible. You have done such a great job of partnering with other organizations that want to provide good quality care to our community. How do you develop those relationships?
So as I began with the Wichita Black Nurses Association, particularly as the president, I needed to establish myself in that role. So I reached out to other organizations such as Grace Med, just came and visited and did a tour of this building when it was fairly new still, came and did a tour and worked with the administration that was here at the time and start working on those relationships. And then we began to develop a partnership where we could do things together in the community. So we started with working with COVID, doing the testing with Grace Med, primarily with Sedgwick County Health Department, but also bringing in Grace Med toward the end, focusing on testing and education. I also work with Health Corps, with Teresa Lovelady, and when they have events that we can be invited to help support them. We are an organization of Black nurses that are here to provide nursing support to other healthcare industries, particularly the federally qualified health centers, but also others that are in the community that are working together, such as Dr. Michelle Van at the center. We just work collaboratively together, developing those relationships and then developing those partnerships.
That's wonderful.
So, Grace Med and Health Corps. I'd also like to mention Urban League, where Frankie Kirkendall. Frankie Kirkendall actually used to live about 3 houses down from me.
Oh, really?
Way back in the day
Yeah.
when we were just in Brooks and middle school, junior high.
Yes.
Yeah, aging myself when it was called junior high, and then Heights High School. But she has worked as a director and operations at Urban League, so
Yeah.
we work with the Urban League also. So they're another organization that we work with and support their mission and ministries. Again, having a lot of faith-based opportunities to work there.
Yeah, I love that. And I'm glad that you mentioned some of your personal history. Talk to me a little bit more about that. Talk to me about how you started nursing school, or what got you excited about being a nurse.
I knew I was going to be a nurse long, long ago. My mother was a nurse, and my oldest sister, who's 10 years older than me, she was a nurse, and I knew it was just in my blood.
Yes.
I'm just a nurturer by nature, and I just knew I was going to be a nurse a long time ago. Even in high school, there was a girl named Sally. I can't think of Sally's last name, but I knew Sally. And I was telling Sally about I'm going to go to nursing school, etc. And she said, "Oh, one of these days you might take care of me." I said, "Yeah, maybe." And guess who I took care of with the appendicitis? Sally.
Oh, really?
Yeah.
That's
So
incredible.
it wasn't that fun. That was fun. And so I knew I was going to be a nurse a long time ago, and went right out of high school into a nursing program.
Okay.
And just continued from 1976
Okay.
when I graduated from nursing school until the present. I keep my nursing license active.
That's awesome.
Because I like for all the nurses in my organizations to keep their nursing license active if possible. We have nurses that are obviously working, but we have a lot of retired nurses also. But 90+% of them have kept their nursing license active because, again, when we go places, we want to be able to provide that support and have registered nurses, licensed practical nurses. Sometimes we have a lot of volunteers that are nurses. We have nurse anesthetists. So we have
That's awesome.
wide variety and diverse team.
Yeah. I had the privilege of seeing the work that y'all do at a community outreach event, and y'all provide the best care when it comes to our community members. If people want to join the Black Nurses Association, how does that happen?
Thank you for asking about that.
Yeah.
So at the event that we were at, one of the things I'm going to speak on how you can become a member, but one of the events that you and I were at, one of the things that I'm very proud of and that we focus on, and when we have what I call a huddle, that we start at every group, we start with a prayer. And then during the huddle also, I like to recognize that every soul that comes through that door is in our hands from the time they enter the door to the time they leave.
Yeah.
We want to provide excellent health care for them, not be seen as, oh, we're just out here and this is just a little health fair. No, we want you to understand we are registered, licensed nurses, and we're here to provide excellent care for you and take care of you, not only maybe with the event, but we usually always have other vendors that are there, maybe American Cancer Society, Red Cross, Senior Life, Medicare, Medicaid, other vendors that the customers, the patients may have access to. And oftentimes talking about some of the other nursing organizations that I'm also connected to and advocating for them if people are interested in becoming nurses. So to join our organization, you can go to the National Black Nurses Association.org, go to the drop-down box and click on membership, and then it'll say chapters, and you can look for the Wichita chapter, and you will find the information on how to join.
Okay.
Also on our website, wichitablacknurses.org, you can go there, and there's also information on how you can become a member. You may also reach out to any one of our nursing members or myself at 316-249-1926.
Nice. Now, forgive me for my ignorance. In order for them to join, can they still be working full time, or do they have to be retired, or how does that work?
Okay. So in our organization, we have registered nurses. We have that are new nurses and also retired nurses.
Okay.
We have licensed vocational nurses, licensed practical nurses, and student nurses.
Oh, okay.
All of those are can become members and that are part of our membership.
Gotcha.
Yeah.
Okay, that makes sense.
Yes, that can join. And often we have the nurses that are working full time.
Yes.
Sometimes they're not able to attend the monthly business meetings, but they are still active as members, and they come and participate. I send out information about the meeting to all of the members. Sometimes we have, particularly during COVID, we had a lot of our meetings by Zoom, and then once COVID was, it was safe to go outside.
Yeah.
We started going back to
Yes.
our location where we have our meeting. But yes, we have a lot of nurses that work full time. As a matter of fact, I'd also like just to mention with that, we had a nurse, and I want to just say her name is Sharon Jefferson, who was the head nurse of the COVID unit at Via Christi St. Francis.
Oh, wow.
Yeah, she was the charge nurse, and she was in charge of that COVID unit during that time, and she was one of our members.
Yeah.
Yeah.
You mentioned the work that when you stepped in to be president, it was during the pandemic, COVID-19, and the outreach event that I attended with you was about the TCE testing.
Yes.
Obviously, you have been able to come in during a time when the community has very much needed you. How do you step in moments of like crisis and to be able to be there for the community, especially when it comes to like the pandemic or the TCE testing?
Yes. So one of the focuses that we make one of our goals annually is what is going on in the community that we need to become part of or that we need to address. And the TCE was one of the serious community issues that was on the horizon that I knew that we needed to become a part of. And reaching out to Grace Med, I was able to partner with Grace Med on this event where we had the Grace Med mobile unit, and we went out to different churches and also senior citizen locations and also other health fair events and did testing of the from the chemical spill at 29th and Grove. So we were testing, doing a CBC, a urinalysis, a chemistry profile, and what's called an alpha fetoprotein, which is like a cancer marker. So we were doing the testing. So we had phlebotomists here from Grace Med and other management from Grace Med, including the Wichita Black Nurses that was hosting that and managing that. And we did that over the weekend so that we could provide access to those that are working through the week that maybe can't get off and come over to the other clinics that were doing the testing, Grace Med, Hunter Health, Health Corps.
Right.
So we were out there in the community providing this service for 6 months, from May of 2024 to December of 2024. And we had 16 clinics that we held, and we saw over 150 patients.
That's awesome. Miss Peggy, I didn't even think about this sooner, but for our listeners and for the people who are watching us who don't know what TCE is or what we're talking about, can you talk a little bit more about that?
So the TCE, trichloroethylene, is like the chemical that they use at cleaners to clean your clothes with. Well, there was a chemical spill way back in the 70s at the Pacific Union Railroad at 29th and Grove, and it seeped into the ground. So it contaminated the groundwater and also the air. And it was not discovered until like the late 90s, early 2000s, and then started to address that when they did the 21st and Grove renovation, and then it was discovered with the drilling and the groundwater, and it was discovered then. And so we have worked with the Department of Health and Environment. They have been involved in looking at the people that are in the 67214 zip code, which primarily are the people that were impacted or affected by this chemical spill. So this chemical is a carcinogenic. So it can look at testicular cancer, renal cancer, renal pelvic cancer, low birth rates, miscarriages, things of that nature. There has been a study done by Kansas Department of Health and Environment where it did show elevated rates of miscarriages and cancer, elevated in terms of the state of Kansas, but some also even nationally. So it really did impact that area.
Yeah. And you're absolutely right. Like, that was a very vulnerable community that got impacted.
Yes.
And with your partnerships, like you mentioned with Grace Med, Health Corps, and Hunter Health, you really stepped in to do these community events. Earlier you mentioned it's because you wanted to make sure they were getting tested when it was available, like during the weekends, not at work. What was the planning process like? What was the mission of that? And how did you bring your team together to say, like, this is what we need to do at this time of need?
So I had leadership, executive leadership meetings with my team to talk about how we could execute on that. How could we partner with Grace Med, met with the Grace Med leadership to talk about how we could put this all together. We had training here at Grace Med to be able to utilize the scanners to because people are not all necessarily patients at Grace Med. They come from other health organizations. And so we had to have a way to, first off, collect the data of the patients that we're seeing, just besides their names. We wanted to be able to assess their vulnerability, so they had a list of questions, I think like 7 or 10 questions, that looked at if they were exposed in terms of where they lived at, so the zip code. Also, if they drink from the water hose, because, back in the day, we would drink out of the water hose.
Yes.
The soil that was contaminated, if they've had exposure to that. Also, just air contamination. So we had these list of questions that we were able to ask the patients and also be able to collect the data with. And Grace Med had a program that they were able to input that information in.
Right.
So we worked through all of those kinks and getting a really great phlebotomist, getting together a really great team, using Grace Med employees that became like my employees on the weekend, and then also my nursing staff. And so we were able to collaborate on that. As I said, we probably had like 2 or 3 trainings just on the use of the laptops and scanning in information, collecting the information, also being able to collect the blood and making sure that we could get it to a lab in a timely fashion, and also being able to then report back to the patient their lab results. So we would on any given Saturday,
Yeah.
we had a schedule that we were working with. We were also actually during that time working with the fire department, Engine House 9.
Yes.
And they were providing drivers, because you
Right.
need, with that mobile unit, you need a driver that had a commercial driver's license. And so we worked with the Wichita Fire Department, Engine House 9, to do that. Collecting that information, having those drivers come at a specific time to a location that's in the plume area, in the contamination area. We would also go outside of that because, again, remember, this happened in like 1970 somewhere.
Right.
And so those people who may have worked there, lived there, went to school in that area, grew up in that area, may not live there anymore, but they may have been contaminated.
Right.
So we also, as I said, went to like 67204 zip code, where you have folks that were brown people that may have worked in that area or worked at the Union Pacific Railroad at that time. So we also created a calendar of events. So every month we had 2 to 3 events that we were going to host or attend so that we could take care of that. So we met at Grace Med, did the training, did the collaboration, leadership met together. I would meet with Dr. Julie Elder and Jason Ybarra and awesome folks. And we put all of that together. And we had our maiden voyage with this in May, and we worked until December, and till the funding had ended. And now we have new funding that's going to become available, and we are going to work on that again. But there will be more folks that are working on that to address the serious problem that's in the community.
Yeah, exactly, because it is a serious problem, and it's very much needed. And the education part is very much needed because when I attended that event, both Grace Med staff and your in your people, the Black Nurses Association, did a wonderful job of educating people who perhaps were scared and nervous and had a lot of questions. Can you talk to me a little bit more about the what do they call it? The bedside care that you did with those individuals, especially when it came to the education part.
Yes, because people hear about that, but they don't really know about that. And they don't really understand, like, what is this TCE? And how does that impact my health? And is it going to have long-term effects? And is it going to, was it passed on to my children, etc.? So we did a lot of education. So we had a table that had a lot of information about that. So when the patients came through the door, we talked about, here's what we're looking at. These are the kinds of labs we're going to draw, and here's why. These are the questions, and we didn't just say, here's a piece of paper, read the questions, answer it, and just go. No, we spent a lot of time educating that individual, and sometimes families came in. Spent a lot of time telling them what TCE is, what we're doing in terms of the testing, and then how within 7 to 10 business days they're going to be notified by Dr. Elder or a designated medical professional, letting you know what your test results were. And then also we had them sign a medical records release so that we could send that to their primary care physician or whoever was providing that. Because again, these folks are coming from in that community that may be a patient at Hunter Health or Guadalupe or any of these other clinics and or private physicians. And so they would send that information on to their private care physician. We were only involved in testing. And when we start up again in the fall, early winter, it's going to be testing again. There's not treatment that has been planned at this junction. Right now we want to educate and test.
And test them. So that way they have what they need in order to talk to their providers and see how they can
and
treat
to
it.
understand what they need to do
Exactly.
to maintain optimal health,
Right, exactly.
to get in front of any potential illnesses that may have.
Yeah.
Because we know that if we can educate people on their health, that gives them a greater opportunity for treatment should they need treatment, and also to lessen the impact on their health if they can be educated about it, because now they know what to do and where to go to receive that treatment.
Exactly.
And they can have a better quality of life and longevity of life.
Very true. We talked a little bit about what you are planning on doing in the future. Talk to me a little bit more about what does the next 5 years look like for the Wichita Black Nurses Association?
We are the goal for 2025 at the national level is membership. We always are focusing on bringing in new blood, just like every other organization. We want to make sure that we keep a pipeline of nurses, because there is a serious nursing shortage.
Oh,
and so we are reaching out to other people in the community and advocating to become a nurse. I am connected to Galen College of Nursing, and that's the new College of Nursing that the old Health Strategies building is now Wesley's building that's across from Wesley Hospital. It's on the 4th floor there.
Oh, okay.
And the dean is Dr. Keisha Brooks, and she's a member of the Wichita Black Nurses Association. So I'm partnering with other nursing colleges to help look for new nurses and provide opportunities for those nurses to come and volunteer with us in the community, and to be able to see and get involved with the community that they're going to be taken care of in a hospital setting or a doctor's office setting, or maybe they may want to do volunteer nursing at like a hospice or what have you. So, there's all kinds of opportunities for nurses. So, Galen College of Nursing, and right now, this is an associate degree of nursing program, but they have been approved for a baccalaureate program that they'll start, because this is their second year where they'll be beginning that. So we are supporting them. I am on their advisory board. It's Professional Advisory Committee. So I'm on their board there. I'm also working with Wichita Tech, Wichita State University Tech, College, on their associate program, and it's Deshawn Williams, and she's the nursing director there. They've come and given us a presentation, and collaborating with these colleges so that we can kind of scoop up some of these nurses and be connected to them and say, hey, come and join us. And not only that, come and work with us in the community, because these are the folks you're going to be taking care of.
And it's important.
And it's important to make it, to establish that, and to be able to understand the population of people that you will serve in this community.
Right. Exactly. If people who are not nurses want to support your organization, what can they do?
They can make a donation. They can go to our webpage, and there's a place where you can click on donation, and they can make a donation. They can also volunteer with us. I have a lot of volunteers that come in that are nurses that are not necessarily members, but they're nurses, and so we have honorary members, and they can come in and join us in serving this community, because this is the community in which they also live. And so whether they're nurses or not, there's other jobs that we have when we host a maybe a health fair, or even when we were doing the TCE, or when we were doing COVID, because you have to bring people in. There's always folks that you need to, as escorts, to bring them in and say, move them from one section to the other. So people come in for that. When we are doing education, just passing out information. So there's lots of opportunities to volunteer, even if you're not a nurse. Or maybe you might be interested in nursing, and you can come and have some direct exposure to what we do as
like
a
shadowing
nurse.
or something like
Absolutely.
that.
Mentoring and yeah.
That's great. Before we end, I want to ask you, is there a story that you could share without sharing any kind of like personal information about maybe a person that you served during the TCE testing that really made an impact, or that you knew we're doing something good here?
I have a personal story. It's not the TCE, but
Okay.
this past March, I was invited to participate with the American Cancer Society.
Okay.
I went to on lobby day.
Uh-huh.
Me and some of my nurses went to Topeka, to the state capitol, where we participated in a presentation to those that were there. Senator Faust, Godot Faust, also Representative Ford Carr, and also the welcome was given by our governor, Laura Kelly.
Yeah.
I was invited to be on the panel to address the income gap with Medicaid and Medicaid expansion. There are 40 states that have expanded Medicare to as a opportunity for people that are unemployed or underemployed, uninsured or underinsured, to be able to have access, because they're working 2 and 3 jobs. So they're the working poor. So these folks are uninsured because they don't make enough money for private insurance to qualify, to do that, nor poor enough to qualify for Medicaid. So this is where you can close that gap with Medicaid expansion. Kansas is one of 10 states that have not adopted the law
That's not expanded.
that can expand Medicaid to include those folks. So I said that to say I have a niece who is 43 years old with stage 4 cancer. She is going to eventually pass from this. She's really being kept alive by medications, and she's on Medicaid. She has 3 children. One is 21 and she's in college, and the other 2 are 14 and 10. And so that's a personal story, but me going to the state capitol and advocating for that was a good thing for us and for our community, because these folks, it's not just my niece. There's a lot of folks like that that we don't know about, where if we are here in the community working and bringing healthcare and education to our community, to Kansans and to Wichitans, then we're doing a good thing.
Exactly.
Because my thought is, if not us, who? If not now, when?
Right. Well, Miss Peggy, thank you so much for spending some time with me and talking to me and sharing your experiences and everything that you and your organization do. I really appreciate it.
It's been my pleasure. Thank you for inviting me.
Thank you. Thank you guys for watching and listening in. We will see you at our next episode. Bye, guys.